Hi friends, today we're going to be reviewing delegation within the nursing practice and review a practice question similar to one you may see when taking your NCLEX Next Generation exam. This is a heavily tested NCLEX topic, so a great one for you to review. Let's get started. All right, so let's begin by examining what delegation is. Delegation involves the registered nurse educating, observing, and verifying that other members of the interdisciplinary team who are not RNs can perform specific tasks that are usually completed by a registered nurse. Within nursing, there are so many tasks, and nurses need to utilize other members of their team to provide the best care for clients. However, it is important that the nurse delegate in a manner consistent with their nursing practice. When delegating, the nurse maintains responsibility to communicate clearly, supervise care, and reassess whether delegation continues to be appropriate. Okay, so now that we know what delegation is and the nurse's role in it, who can the nurse delegate to? Pause this video, think this over, and then press play when you're ready to discuss the answer. All right, the nurse can delegate to unlicensed assistive personnel, or UAPs, as well as licensed practical nurses, or LPNs for short. You may also hear VN for vocational nurse instead of LPN. And also remember that RNs can delegate to other RNs. Now that we know who the nurse can delegate to, let's review what tasks can be delegated to each person based on their licenses. Beginning with UAPs, can you think of any tasks that can be appropriately delegated to a UAP? Pause this video, think it over, and then when you're ready, press play and we'll review. Appropriate tasks that can be safely delegated to UAPs include hygiene care, including bathing and toileting, assisting with ambulation or activities of daily living, oral feeding, which is an important distinction. This does not include tube feedings. UAPs can also take vital signs, blood glucose, and intake and output. Now let's do the same thing for LPNs. Press pause, think over what tasks can be safely delegated to an LPN, then when you're ready, we will review. Okay, moving on to delegating to LPN. The registered nurse can safely delegate medication administration as long as it is not high-risk medication or a medication that needs to be titrated, such as protonics, administration of enteral feedings. Note how that is different from UAP. An LPN can perform tasks like wound dressing changes, tracheostomy care, and suctioning. They can also monitor blood administration, complete re-education, and perform any task a UAP can. Something to keep in mind as well is that LPNs can delegate to UAPs. One other thing I want to point out is that LPNs can re-educate but cannot provide the initial education to clients. The initial education must be performed by a registered nurse, which brings me into what can be delegated to a registered nurse. An easy way to remember this is that the registered nurse must do anything initial. An initial assessment, initial education, anything initial is a registered nurse's responsibility and cannot be delegated to anyone other than another registered nurse. In addition, registered nurses can administer IV push medications, initiate blood products, and medications that require titration and continuous monitoring. So that in a nutshell is delegation, safely passing on tasks that other individuals within the healthcare team can complete. Now let's run through a practice question that involves delegation to really help this information stick in your mind. This question type is a drag and drop that is similar to one you may see on your exam. For this example, we won't be dragging and dropping, but I will have the text appear in the appropriate boxes as we discuss. Just know on your exam, you would drag and drop the text into the correct boxes. You are a nurse on a busy medical surgical unit. You are working with a nursing team consisting of another registered nurse, licensed practical nurse, and unlicensed assistive personnel. For each answer choice, indicate whether it should be delegated to one of the RNs, the LPN, or the UAP. Administering medications to a stable client with a known medical history, collect blood samples from a client with a central line, complete a bed bath and assist a client with personal hygiene, monitor vital signs for a client post-operatively who recently arrived on the unit. Take a moment to pause the video, review each option, and decide on an answer. Then when you're ready to resume, press play and we will review. Okay, let's review. First up, administering medications to a stable client with a known medical history. When considering delegation, do you know if an RN, LPN, or a UAP should complete this skill? Well, let's break it down. Administering medications cannot be completed by a UAP, so we know it must be the LPN or an RN. Let's make a note that this could be completed by either and consider the other choices before deciding on this one. The second one on our list is collect blood samples from a client with a central line. Again, let's review who could complete this task. We know it cannot be a UAP, so again, it must either be an RN or an LPN. Drawing from a central line should only be performed by a registered nurse. So we know this would be a task delegated to an RN. Next up, complete a bed bath and assist a client with personal hygiene. If you said UAP, you'd be correct. A bed bath is definitely within the scope of practice of a UAP, and by delegating this task to the UAP, it leaves the remaining RN and LPN to complete any remaining tasks. Last one here, monitor vital signs for a client post-operatively who recently arrived at the unit. If you said an RN should complete this, you got it. RNs are typically responsible for more complex assessments and interventions, especially in critical situations like postoperative care. So now that we've decided the UAP should complete task number 3 and the RNs should be completing task number 2 and 4, that leaves us with the LPN completing task number 1, administering medications to a stable client with a known medical history. Correct. All right, that is everything on delegation. Thank you for reviewing with me today. I hope you found this video helpful, and I will see you next time.